Hello and welcome to Health Matters. I'm Sherri Gallant with Alberta Health Services, and today we're coming to you from the Shaw studio in Lethbridge. We're very excited about that. Zoom has been our tool for the past couple of years for overcoming COVID-19 restrictions, but now we're able to meet in person a little more often, and we're really happy about that. First up, we're going to talk with Julia Gedlaman. Julia is a dietetic intern with Alberta Health Services, and she's going to talk about one of my favorite topics, fall comfort foods. Welcome, Julia.
Thank you for having me.
Thanks for coming and being with us. With the colder weather, people have been maybe thinking about comfort foods. I know my friends are talking about soup. What would you suggest?
Great question. Soups and stews are perfect as a warm, cold weather meal. They're packed full of delicious flavors and can be super nutritious, especially if we're going to make them at home. Vegetables that are often used in soups and stews are carrots, parsnips, sweet potato, broccoli, and onions. And these vegetables are all in season in Alberta in the fall and are likely to be grown around where you live. Because they won't have to travel as far to the grocery store, they are often cheaper and tastier.
You can't lose with any of those things, local and fresh. What could I add to my soups and stews to boost up the nutrition factor?
It can be pretty simple to make your soups and stews a little bit more nutritious. Adding vegetables and legumes such as chickpeas or black beans or lentils is an easy way to get nutritious foods into your soups and stews. Vegetables contain nutrients like fiber and lots of vitamins and nutrients and minerals, and legumes contain fiber and protein. As a bonus, adding more vegetables and legumes to your soups and stews may help you stay fuller for longer as well. And that's because they contain lots of fiber. High fiber foods tend to keep you more full than low fiber foods, so you're likely to eat less and stay satisfied for longer.
That's awesome. So how do you incorporate some of these things?
Whether you're cooking on the stovetop or you're cooking in your slow cooker or pressure cooker, adding in vegetables and legumes can be super simple. You can just try chopping up some in-season vegetables. My personal favorites are carrots and sweet potatoes, or add in a can of tomatoes, or even some frozen vegetables to your favorite soup. You can add canned legumes like black beans or pinto beans to a beef soup, or you can use dried legumes. Just make sure that you soak them according to the package instructions first.
Okay. Do people have to worry with the hard vegetables like you mentioned, carrots and sweet potatoes? Do you have to pre-cook them or can you just put them right in?
Typically you can just put them right in. As long as you're going to be cooking that for a little bit, maybe half an hour, it's a good amount of time.
They will cook just perfectly,
That's
right? Okay, so you're preparing this beautiful pot of food. What are some tips for maximizing the enjoyment?
That's a really good question. My number one tip is to try to enjoy your food with others. So any meal that you're going to have this season, try to get together with some friends. If you live with someone, have dinner together or make it together and then eat together. We know that eating with other people can make it so much more enjoyable than eating alone. Mm-hmm. And my second best tip is to keep it interesting with new spices and recipes. So many areas around the world have delicious traditional soups and stews. You can try a new Indian curry or a new Thai soup like Tom Yum Kung, and it keeps things interesting and you might just find your new favorite meal.
Okay, let's say you have made a huge batch or you have some leftovers. How do you store it?
This is a very important food safety question. So whenever you have leftovers of a hot meal like a soup or stew, you want to make sure that you cool it down as quickly as possible. You can do this by dishing it into a shallow dish and then putting it into the fridge. Food safe temperature is about 4 degrees Celsius, and keeping foods like soups and stews above this temperature for more than a couple hours can allow bacteria to grow really fast and make it unsafe to eat. So you can also freeze leftovers, and this prevents bacteria from growing at all. And I would recommend trying to freeze those in individual portions for easy reheating. Just make sure to wrap them really tight or to put them in a covered container. So if you are storing leftovers at fridge temperature, soups and stews will be good for about 3 days. If you're going to freeze them, Health Canada suggests to eat frozen leftovers within 4 months. It may lose some of its quality after this time, but depending on your freezer, it might even stay good for longer than that. Labeling your leftovers can be really helpful to make sure you use them at the right time. For more information on food safety and food storage, you can check out the Government of Canada website under Health Canada and General Food Safety Tips.
Fantastic. I was really interested in what you said about cooling them quickly, because I remember as a child my mom leaving things out to get to room temperature because she was worried about condensation. Right. But now we know that's not necessarily safe.
Yes.
Good stuff.
Condensation is fine.
Good stuff. Thank you so much for bringing us all this wisdom, and I think when I go home I'm going to head straight for the kitchen and maybe start some soup. Please stay with us, because when we come back we'll be talking about how to prevent one of Canada's and Alberta's most common causes of injury. Welcome back. We are with Chloe Trautman. Chloe is a health promotion facilitator with Alberta Health Services Population Health Promotion Program. And we're going to talk about what is one of the most common causes of injury in this province and in this country and probably everywhere, and that is falling. And November is Falls Prevention Month. Thanks for coming to join us, Chloe. What can you tell us about Falls Prevention Month? What's happening and why do we do it?
Yeah, absolutely, Sherri. So the month of November is Falls Prevention Month, a whole month dedicated to raising awareness about falls in seniors and empowering older adults to stay independent and prevent falls in the first place. The number of falls among seniors are the leading cause of injury-related hospitalizations, and older adults make up among Canadian seniors, they're 11% of the Canadian population, but account for 35% of these hospitalizations. So after a fall, many people are unable to live the way they want. They might be in a fear of falling again. And so we want to encourage folks to do the things that help them prevent falling in the first place. Falls shouldn't be considered a natural part of aging and getting older. It's important that we focus our healthy aging and prevent falls from happening in the first place. Finding Balance is a seniors falls prevention initiative, and they developed with Injury Prevention Center at the University of Alberta. Finding Balance focuses on an education program and public awareness campaign that is designed to educate seniors to stay independent.
Okay, what are the recommendations, if you can say in general, for preventing a fall?
Yeah, so every year 1 in 3 Albertans will fall, but there are things you can do to prevent falling. Finding Balance explains that seniors can prevent a fall by keeping active to improve strength and balance, reviewing your medications yearly, and having your vision checked on a yearly exam also. Ways you can prevent a fall are through 3 key areas: challenging your balance, building strength, and being active. So challenging your balance is all about controlling your movements. So tips to consider are practice movements such as reaching while standing, toe and heel raises, stepping in different directions, step-ups or half squats, and other ways to challenge your balance would be to join a sport like Tai Chi or yoga. The next key area is to build your strength, and ways to building your strength to prevent a fall are through exercises for your leg muscles by using bands, weights, or your own body weight. Build strength by doing squats, hamstring curls, and side leg lifts. And lastly, another way to maintain balance and strength is by being consistent and staying active. So finding an activity that you really enjoy doing will help you do that, and trying to do at least 30 minutes or more of moderate to vigorous activity or exercise at least 5 times per week. Falls can mostly be avoided by taking steps to reduce the risk of falling, and Finding Balance has a lot of helpful information on reducing the risk and staying healthy, with resources on medications, vitamins and supplements, vision and eye health, getting a good night's sleep, eating healthy, staying hydrated, shoes and foot care, getting around in your home, and getting around in your community. All of these great things will help you to prevent a fall, and all can be found on Finding Balance's website.
Okay, I'm interested in the connection between falls risk and medication. Can you expand on that a little bit?
Absolutely. So medication use is one of the many risk factors of falls in older adults. The more medications that you're on, the higher your potential risk of falling is. They say taking more than 5 medications can increase your risk of falls by 75%. Certain drugs can also increase your risk of falling in the first place. For example, blood pressure medications can make you feel dizzy, weak, or confused. Medications like sleeping pills, antidepressants, anti-anxiety medications, seizure medications, or opioid painkillers. These medications that affect your brain can make you feel sleepy, dizzy, confused, or reduce your balance. While all medications can have potential side effects, it's super important that you speak to your healthcare provider first before you consider withdrawing from a medication. You can talk to your doctor or pharmacist about these medications specifically and symptoms and the potential to experience a fall so that you have that knowledge while you're taking the medication. They can assess you and your medication to determine the best plan for action.
Okay, and I suppose too, if you must take the medications, doing some of those other things like building your core strength in a safe way would help.
Absolutely.
To mitigate that as well.
Absolutely.
The other thing that I'm thinking about is that winter is coming soon, and what are some ways that we can keep from falling in the winter?
Yeah, absolutely. It's a great question. And so adapting the way you walk on icy, snow-covered surfaces can help you prevent falling. So taking action to avoid a fall in the winter by taking your time and avoid rushing, that's a big one. When possible, avoid walking on the snow or ice, although that isn't always possible. Wear shoes or boots with a wide, flat heel. Make sure your footwear has the proper amount of grip, not too much and not too little, finding that right balance. Wear ice grips over your shoes or boots if you're finding that you don't have enough grip on your shoes. Choose footwear with soles that stay flexible in the cold. And if you use a cane, putting a retractable ice pick on the end of it could be an option. Carrying a small bag or container of sand that you could sprinkle on icy spots that you aren't able to avoid. And keeping your hands free for gripping handrails or supports. When going indoors, stomp the snow off your footwear and remove the ice grips if you're going from carpet to a flatter surface. And another tip that you may have heard before is walking like a penguin. And so bending slightly, walking flat-footed, imagine a penguin, you point your feet out slightly, keeping your center of gravity over your feet as much as possible. Watch where you're stepping and keeping your arms at your sides and not in your pockets or something. And concentrate on keeping your balance, and as always, go slowly. Don't rush too much where you're going.
If people are curious about Walk Like a Penguin, you can go to our website at ahs.ca and just put in the search bar Walk Like a Penguin, and we've got videos and all kinds of tips in there, and
Yes.
our cute little penguin too, to show you how it's done.
Yes.
Where are a place where people can go, seniors or others, for more resources on how to stay safe and stop yourself from falling?
Yeah, absolutely. So since November is Falls Prevention Month, I recommend looking at your local seniors organization and seeing what types of activities they might have going on. There's lots that is going to be happening in Southern Alberta, so it's just a matter of seeing what's happening at that local organization. And I also would recommend checking out Finding Balance's website at www.findingbalance.ca. They have loads of information that I explained about today, and even more so. They're just an amazing resource, and they have lots that you can look through. They also have a Safe Winter Walking the Snow Moles on Patrol webinar if somebody is interested in learning more. It's an age-friendly volunteer program to root out winter walking problems, and so it's actually something that happens in the city of Ottawa, so we're hoping to learn more from them. And all Canadians have a role to play in preventing falls, so let's all do our part and create an impact on staying independent and preventing falls across the lifespan.
Very wise. Thank you so much.
Thanks, Sherri.
Thanks for staying with us. Hang around. We'll be back in a minute. And we're back. This time we are joining our guest via Zoom. Krista Dumba is a health promotion facilitator, and she's going to talk with us today about mental wellness. We know that that topic has been really elevated recently. People have been going through a tough time in the past couple of years due to the pandemic and the changes that it's brought into our lives. So welcome, Krista. We're so glad you could join us via Zoom, and let's just dive right in. I understand that you work on the mental health promotion and illness prevention team for AHS. What do you mean when you talk about mental health promotion?
Well, Sherri, thank you for having me. I'm super happy to be here. When we dive in, and we're going to, mental health promotion is really a directed way of using evidence-based practices and policies and approaches to maintain and enhance mental health for individuals, communities, and also society across the entire lifespan from birth to death. So what I mean when I talk about that, it sounds like a bunch of mumbo jumbo probably, but we're talking about individuals and how to enhance their mental health promotion pieces. So that would be learning skills that are individually based, things that can help reduce stress, like breathing, meditation, yoga, getting outdoors, doing something creative, being physically active, and eating to support your brain and body's health needs. That's kind of those personal skills that we would use at an individual level when we're talking about promoting and supporting mental health that way. When we're talking about mental health promotion in communities, that would involve things like community development programs, maybe a neighborhood renewal, something like a community garden so people can get together, or maybe the building of public parks or sidewalks or green spaces or bike paths. Those kind of things can help bring people together, get us outside, and renew us and bring us health, mental health and physical health. There is also things like school-based programs, when we're talking about community stuff for children to develop social and emotional skills. So that would be things like, how do I manage myself? How do I know myself? How do I understand my own emotions and relationship skills? And it's not just those individual things that we learn in the classroom as part of the classroom, but it's also the environment. So if we're just talking to kids and we're telling them, okay, you do this and play here and be nice, but without the teachers being kind, or without having the school being kind, or the welcoming environment when you walk in the school, if you don't feel like you belong as a parent, as a teacher, as a substitute, as a student, as any staff member, that type of environment isn't going to be as healthy. So community programs that promote and support mental health could also be something like structured opportunities in community arts programs, or things where we have civic participation. So when we do something together as a group, we know that what we've done has made a difference in that community. And maybe that's a safe walk program, or a getting to know your neighbors program, or maybe it's building some special space for emergencies. Maybe we need, who knows, a solar powered cell station so that if the power goes out, people can meet and find a place to plug in their phones and get information that they need to get.
I'm wondering about something. It seems to me that people often confuse the terms mental health and mental illness. Do you agree? Do you find that?
Yes, I totally do. It's a great observation. People do confuse the terms, and honestly, it's understandable. We've used them interchangeably for a long time. If you have a mental illness and you're really not well and you go to the hospital, you go to a mental health unit. Right. And in fact, just recently, I have a colleague who shared a story with me and it made me laugh. He was doing what was called a mental health promotion check stop. So they were just stopping people and asking how they're doing, how things are going, and handing out community resources if anybody wanted to learn about meditation or yoga or that kind of thing. But one person that they stopped said, "You think there's something wrong with me?" And so So I'm not laughing at that, but what I'm saying is that the intent was not that at all. However, there was such a confusion about it. And of course they worked it out, but there is still a stigma about mental illness. Still a misunderstanding about what mental health is because people assume it's mental illness. And you know what? It's stuff that we still, I hate to say this, but we don't want to talk about. And it's hard. And I know that. But coming out of the pandemic, I'm hoping that language and our literacy for mental health really changes. I think one of the things that we can do to help ourselves with that is to remember that, 1 in 5 people have a diagnosed mental illness. So depression, anxiety, schizophrenia, borderline personality disorder, those kind of things happen in 1 in 5, but 5 in 5, every single one of us has mental health. And so you want to call it mental health, you want to call it mental well-being. It's measurable. And we know that for every one of us, good mental health is the best. Moderate, not as good. Poor, the worst. And it doesn't matter if we have a mental illness or not. Any one of us will suffer and do poorly. But what we know is that at good mental health for all of us, we work better, we think better, we play better, we are better in our lives, in our relationships, in everything that we do, in our health too. So promoting and supporting that is what we're really all about. And we'd like for people to know that your mental health is not static, just like your physical health. You can be sick and have a cold, right? And that it takes balance and day-to-day practice to help build up your mental health, just like it does your physical health. And we can't do that alone. Our environments need to support that. So again, long answer. Any questions about that one, Sherri?
No, I had a thought though while you were talking about it, and that is that while we I guess we think of ourselves as a North American society may have a reluctance to talk about it or share about it, we have an ever flowing population of new Canadians coming in and new Albertans from all over the world in various states of maybe distress.
Absolutely.
And I know that culturally they may also have their own issues with talking about it. So I think the fact that we're talking about it and raising awareness is helpful to maybe those people as well.
Absolutely. And you're right. We do need to be able to talk about it and have some emotional literacy and be able to support each other through all of this. Not everyone has a mental illness, but we all have mental health. And I keep coming back to that and back to that. And we want it to be at our best. That's all I can say. Yeah.
That's a great line. What sort of workshops do you and your team do to promote and support mental health?
Sure, I will talk about that. We have quite a few, but I'd like to focus on 2 in particular. The first one is called Wellness Exchange. Wellness Exchange is a series of 5 skill building workshops that are designed to help people increase their coping through exploring themselves and reflecting upon what they learn in the information that's given in class. So there are 5 topics, and you can take 1 topic per week, or you can just take the topics that are most interesting to you. And I'll just give a little bit of background about each one. And if you have any questions, stop me, okay? So the first one is called problem solving. It helps us define our problems and figure out if the problem is even ours. I don't know if you've ever done that. You take on something that's not yours. You worry about someone else's problem that doesn't actually belong to you. Just me? Yeah, I think it's okay, it's just me. So this workshop really helps us take a look at what we can do realistically to influence what we can and maybe let go of what we can't, and identify some possible solutions. And here's the thing about solutions. You can try them. If they don't work, you're back at the drawing board again. And that's just the way life is. And it reminds us that it's okay to keep trying and to keep trying. And eventually you'll get to a place where you feel more comfortable. Got to set that realistic goal. The second workshop in this series is called Positive Activities. This one really helps us to understand what we need to do to care for ourselves, and that doing things we like really helps us to reduce stress and cope better. You might be surprised at how small and quick free positive activities can be. And I just want to, if you would like to right now, do one with me. And it's just a breathing activity. And I know we're going to look a little goofy for a second, but what we're going to do in this one is stretch our arms out, breathe in, put a smile on our face. And as we breathe out, we'll just bring our arms back down and open up our chest. So let's do that together. So we'll breathe in. Smile, breathe out, open up your chest. And we'll do it one more time for fun because I actually need this to relax. A little bit nervous here. Breathe in and breathe out. Sorry for the heavy breathing in the mic. Okay, so one thing about positive activities is that we tend to think maybe we need to do a big hour of something or have to go hiking or maybe a full spa day. I know I can't afford that. I'm pretty sure lots of people can't anymore. So what we're talking about is just those little things like breaths that we can take in the moments, those little breathers, those little breaks. And it's not big, expensive stuff, but it has to be ongoing. And that little few seconds can make a difference throughout your day to how you feel at the end of the day.
We've talked about how accessible the workshops are, but how does a person go about registering if they are interested?
Sure. So for Wellness Exchange or Transform Your Stress, all you need to do is use any online search engine that you like, type in Alberta Health Services or just AHS Help in Tough Times. So that's AHS Help in Tough Times. And then you'll find our workshops are listed about halfway down on the right-hand side under mental health online sessions. And they're on that web page. And you can look and see what's available and any opportunities there that exist for you to take. It's all free and it's there for you for helping with stress reduction and managing reactions and all those good things that we need to do as part of building our own mental health. I just want to thank you so much, very sincerely, for the time that you've given us today. I can't think of anything more important to talk about right now, or maybe at any time. So sincere appreciation. We're going to put all those resources up on the screen to help people out too. And once again, all the best. Thank you very much, Krista. Really appreciate it. Thank you, Sherri. So happy to be here. Thanks for the invitation.